and thank you for joining me in my latest Medicare Monday video. This week I'm continuing on in my new series where I'm covering topics aimed at individuals who are approaching their Medicare eligibility. This is in hopes to enhance your understanding of what Medicare is, how it works, all its various components, parts and pieces, and how they all work together. So by 2023, around 31 million people were enrolled in a Medicare Advantage plan here in the United States. That is a significant increase from the 26 million back in 2021. This figure represents over half of the eligible Medicare population and equates to approximately $454 billion in federal Medicare spending. Also in 2023, the average Medicare beneficiary could choose from 43 different Medicare Advantage plans. That is a huge number of plans to try to go through and pick the right one that's just for you. But what is a Medicare Advantage plan, and why has it grown in such popularity? How do these plans work, and when can you enroll into a plan? Well, that's what we're going to discuss today, so stay tuned for more. A Medicare Advantage plan, also known as a Medicare Part C, is a private health insurance plan approved by Medicare. So when you enroll in a Medicare Advantage plan, you are authorizing Medicare to pay the plan for your medical care. In return, the plan provides all of your Medicare Part A and B services, effectively assuming all of your medical risk. Eligibility requires that you enroll in both Medicare's Part A and B. You must reside within the plan's service area, and you must continue paying that Medicare Part B premium while you're enrolled in a Medicare Advantage plan. A notable benefit of the Advantage plans is that there's a large majority of them that include the Medicare Part D, which essentially eliminates the need for a separate prescription drug plan, which would be necessary for a Medicare supplement plan. Also, Advantage plans include a out-of-pocket maximum cap on all medical expenses, acting as a financial safety net in emergencies. This out-of-pocket limit is determined annually by each plan individually and will never exceed the Medicare's set maximum for that year. Should your health expenses reach that threshold, the plan covers any additional costs for the rest of that calendar year. It's important to note that Part D expenses are separate and do not contribute to that out-of-pocket limit. Similarly, any co-pays, co-insurances for prescriptions are separate from the amounts spent on any inpatient or outpatient services within any given year. It's important to know that a Medicare Advantage plan is not the same as a Medicare supplement plan. Medicare Advantage plans work differently because they pay instead of Medicare and not after Medicare like a Medicare supplement plan would. Enrollment in a Medicare Advantage plan is possible during your initial Medicare enrollment period or during the designated election periods that occur each year. We will be going over those election periods later on in the video, so stand by for those. Medicare Advantage plans often feature lower monthly premiums compared to a Medicare supplement plan. However, you might end up paying more out of pocket over the course of the year for healthcare services due to the cost sharing payments made to the providers. Advantage plans may also include extra benefits like dental, vision, and hearing, or even things like free gym memberships or over-the-counter allowances for such items as supplements or vitamins. It's important to understand and realize that while Medicare Advantage plans are not obligated to provide these additional benefits, they frequently offer them to entice beneficiaries to enroll in their plans, thereby allowing them to receive payment from Medicare for assuming your medical risk. Medicare Advantage plans typically function within a HMO or PPO provider network. HMO plans are favored for their often lower premiums. In certain cases, HMO premiums can be as low as $0 a month, which means that you wouldn't be paying anything for the plan, but just your Part B premium that you already paid to Medicare. Enrollment in an HMO plan typically requires you to seek treatment from providers within the network, except, of course, during medical emergencies. Medicare Advantage plans establish contracts, with specific doctors and hospitals in your area to create these networks. You must choose a primary care physician within this network to manage your health care. But should your primary care physician be unable to address a particular health issue, they will then refer you to a specialist within that network to help you. Generally, HMO networks have more limitations compared to a PPO, which is what I'll be explaining next. PPO Advantage plans have more flexibility than an HMO plan. In a Medicare PPO, you can go outside the plan's network for your services. If the physician is, but that is, of course, if the physician is willing to bill your plan for it. However, you generally will pay lower co-pays if you stay within a provider that is within that network. With a PPO plan, you aren't required to choose a primary care physician or obtain referrals to see a specialist. However, each plan has specific rules, so it's crucial that you review your plan's summary of benefits or evidence of coverage before enrolling. A key aspect of Medicare Advantage plans is their annual vulnerability, right? You may enroll in a plan with rich dental and vision benefits, only to find out that those are significantly diminished or eliminated altogether in the next year. Fortunately, the fall annual election period, or AEP, provides you with an opportunity to change your plans each year. Keep in mind that Medicare has issued disclosures regarding Medicare Advantage plans. Limitations, co-pays, restrictions may apply to each plan's benefits, formulary, pharmacy networks, provider networks, and premiums, which may change every year on January 1st. It's important to diligently review the plan's materials that are sent to you each September. This is to ensure that you have an understanding of what the plan changes are for that upcoming year. But keep in mind that there are two primary opportunities to change or disenroll from your current plan during these two designated enrollment periods. This, of course, is unless you qualify for a special election period throughout the year. The first enrollment period is the fall annual enrollment period, which is also known as the AEP. This period runs from October 15th through December 7th, at which time you can leave your current plan and enroll into a all-new Medicare Advantage plan that's better for you. This plan wouldn't start until January 1st, though. Or you can leave your current plan altogether, return back to traditional Medicare, and enroll in a standalone Part D prescription drug plan to go along with it. The second opportunity that you have is the Medicare Advantage open enrollment period, which runs from January 1st through to March 31st. This offers existing Medicare Advantage plan members a one-time opportunity to switch their plans. During this time, you can either enroll in a different Medicare Advantage plan or completely opt out, return back to, again, traditional Medicare, and sign up for a standalone Part D prescription drug plan. Medicare Advantage plans all have different networks, premiums, and cost sharing. And if you live within a large urban area, you may have 20 to 30 different plans to choose from. This is where working with an independent Medicare agent like myself is a great way to ensure that you consider all of your variables prior to choosing the insurance plan and company. I truly hope this video has provided some clarity on what a Medicare Advantage plan is and how they work. But don't forget to join me every week for my next Medicare Monday video, where I'll continue exploring more topics to assist those who are becoming eligible for Medicare. Should you have any questions regarding this topic or any other aspect of your Medicare coverage, please feel free to reach out to me using the contact details provided below for a complimentary consultation with no obligation. Additionally, if you are new to my channel, don't forget to click the subscribe button to get notifications for any of my new upcoming videos. And if you found this video useful, you're more than welcome to like it by hitting that thumbs up button and or sharing your thoughts in the comment section listed below. Again, my name is Danial Partridge. I am your independent Medicare agent. I appreciate you guys being here. I hope this video was helpful, and I look forward to seeing you next Monday. Thank you.